let's see about the Florence Nightingale environmental theory. Florence Nightingale, who is she? She born in 12th May 1820 in Italy. She died in the year 1910 August at London. In between the time, she has tremendous work she has done and contributed much to the modern nursing. So she has been called as a founder of modern nursing. And during the Crimean War, her contribution was very much, and it was highly appreciated by everyone. She is the heroine of the Crimean War. She is the first theorist. She is the lady with the lamp. She is the great statistician, and she is the one who proposed there is a specific training is necessary for the nursing profession. On 1860, she used her fund and to establish the world's first professional nursing school at St. Thomas Hospital at London. Let's see what is her theory. What is the theory? Florence Nightingale theory. Let's see what is the concept. The theory is a set of concepts, ideas, propositions, and interrelationship of the concepts and predicting the view of some particular phenomena. So she has created some phenomena. This phenomena is called the environment. So she is talking much about the environment. The nurse is the one who dealing with the patients, and the patient who she is describing who is patient or the person she is mentioning in her diary. She is talking about the nurse, who is she, how the healing is taken place, what is the approach towards the patient or person, how the person has to deal with his health and illness, and what is the environment. She relating with the patient and environment. Let us see what she is telling about these things. Her concept mainly, she is telling health is not a well or but to be well or able to well. It is like to use well what we have the inner potential in our this one. So she is talking about the nature alone cures. This act of utilizing the environment is a very important one. The patient has to help to assist his environment, so his recovery will be taken place. So the nurse can manipulate the environment, the compensate for the client's response to it, assist the patient staying in balanced environment. So she is talking about her concept is like she's talking about her concept. I put it in a schematic view. What she is telling, I told you there is a set of concepts and ideas. I put the Florence ideas in a schematic representation. She is mainly talking about the nurse, patient, and the environment. So the patient and environments are interrelated with each other. The balance has to be maintained. Then the person have a innate recovery power. He will heal. It is not the nursing to study or talk about much about the anatomy and physiology. To promote healing by influence the environment and giving him the proper environment, so he will be healing by himself. The nature will help him. The nurse and the nursing action, patient and his environment. If you take these two concepts, patient and environment, the patient she is telling as a patient or the person in her diary. She is talking about the physical environment, psychological environment, and the social environment. The physical is the light, warmth, ventilation, control of the noise, and the proper diet. The psychological environment, she is talking about the action or the negative or the positive act which bring the stress or any emotional instability she is talking about. Social environment. Social environment, she is talking about the home, hospital, home, and society, and the community. So this is called acceptance by the patient. So this is the patient and his environment. The nurse is how the nurse now should be accurate observation. She should have control of the environment, therapeutic communication, verbal and non-verbal communication, and hands-on experience. See, all these must be a greatest quality of the nurse, and she has this innate quality in his nature. She has to interact and influence the person, manipulate the environment, and communicate effectively. The communication must be the therapeutic and soothing. If you are doing like this, rather focusing on anatomy and physiology, you concentrate this, then there will be a innate power. The person will be, the outcome will be very fruitful. The outcome, she is telling that the outcome should be, the nurse has to do in a statistical form. The outcome in an orderly manner, the outcome has to be reported to the doctors. So the statistical view plus documentation of the morbidity, mortality or any illness. Then health status analysis. So it will be helpful for the doctors and the nurses to analyze the health status of the person. That will help to reinforce and modify this one. So this is her concept. I put it in this view. This is the idea. During that time, there was no nursing, there was no profession like that. Her concept has been ideally proved. She has proved this one. So, according to that, she has prepared about this one, about she talking about the meta paradigm. So, the meta paradigm is person in the patient. In her writing, human being is affected by the environment. Human being have a reparative power to deal with his own diseases. Recovery with the patient is the power as long as with a safe environment. So the safe environment the nurse has to create. With this what we have seen here. Health. According to her, the maintenance of well-being by using the person's own power, the innate power, with the fullest extent the disease as view as a reparative process. It is initiated by the nature. The nursing is not curing, nursing will influence, the nature alone will be cures. The nurse who focus the health and disease of the patient to help him through the healing process. So she is meant to say that nurse is a facilitator. The nursing is aims to promote the fresh air, light, warmth, clean environment and proper diet, and facilitate the person's reparative process by providing the best possible environment. Environment may be physical, psychological or social. Modify and influence the environment. Focus the repairable rather than the anatomical structure or physiology. Report to the physician in an orderly manner. Also, she is talking about the another meta paradigm is the fourth one is environment. There are three types of environment Florence is speaking. They are the physical, psychological and social. Physical environment consists of where the patient is being treated. The treatment may be at home or may be in the hospital or be in the community. She is meaning all the environment. That psychological environment involves the communication with the person. Communication should be the therapeutic, soothing and unhurted way. Social environment includes homes, hospital as community. So this is a first theorist and this theory is applicable to useful for the nurse practitioner and ICU environment, ward, community services, palliative services, also the home care services. So this is the main concept of Florence Nightingale theory. Okay, many theories are there. We are seeing that you and me may get an idea that why you and me cannot make a theory. Yes, of course we can make a theory. You can create idea and make it. But this theory has to be tested and proved and then only it will be approved by the people. Thank you.